News I-Team has been digging into this story since it first broke. Tonight, we're learning that the victim had a physical exam 8 months before giving birth.
Team 12's Bianca Bono continues our team coverage on this disturbing case. Bianca.
We brought these documents to a doctor in an effort to answer some of the many big questions in this case. Should her doctor have known she was pregnant at the time this physical was done? And were the medications she was being given safe for her baby?
How could this have been missed?
Dr. Andrew Carroll combing through a stack of documents obtained by the 12 News I-Team, trying to find any answers in the case with so many questions.
She's a total assistance.
Dr. Carroll has never treated the woman, but like many in the Valley and in the medical field, he's following the case closely.
She could not do anything on her own.
He's talking about the 29-year-old San Carlos Apache woman who was raped while in a vegetative state at Hacienda Healthcare, giving birth to a baby boy on December 29th.
Given that she delivered on December 29th, it meant that she probably would have conceived somewhere in early April.
One of the many public documents showing part of the woman's medical history, a physical exam conducted on April 16th. If she delivered full term, she likely would have been pregnant at that time.
You certainly wouldn't have noticed any physical exam changes, especially on a well woman.
Dr. Carroll notes there is no record of menstrual cycle in the documents, saying that may have been the only way to determine pregnancy just weeks after conception. But he believes this patient would have started showing physical changes much earlier than the average woman.
She's probably spoon-fed. Means that she's probably fairly thin. Given that, she's probably going to show much earlier, around 12 weeks.
But sources saying employees at Hacienda Healthcare didn't know this woman was pregnant until her baby was crowning, meaning, according to the documents we obtained, she continued to take a long list of medications ordered by her doctor. Carroll saying one in particular could be potentially harmful to a fetus. Like most in the Valley, Carroll haunted by this case, hoping police figure out who is responsible and how this could have happened.
And if that safe environment can't be provided, that environment needs to be changed.
And some of you have asked if anyone violated this woman's HIPAA or medical privacy rights in releasing these documents. We want you to know these are a part of a public court filing. Because her mother is her legal guardian, they have to be filed in court every year. We're in the Alert Center. Bianca Bono, 12.